here with Mike Bell, CEO at Kingston Community Health Centre. How are you today?
Very well, Hillary. How are you?
Wonderful, thank you. I'd like to start off by asking you about the Kingston Community Health Centre, your services, and the community that you serve there.
Sure, thank you. Well, Kingston Community Health Centres has been around for over 30 years, and really the main mandate is to serve those individuals in our communities who need it the most. So that could be any social determinants of health, such as poverty, Indigenous health, newcomers to Kingston and area, mental health and addictions. We have a large rural portion of our community health center, and then with a special focus on health promotion, trauma and violence informed care as a paradigm to what we do at KCHC.
That sounds great. Like a lot of community health centers, you cover a wide variety of people and communities. What is the current situation in Ontario in terms of access to community health centers? And I know Ontario does have quite a few, but why would you say we need more to expand the services that community health centers provide?
Yeah, I think that the climate of healthcare and healthcare transformation across Ontario and across Canada is really one of nothing novel about trying to integrate and coordinate care more than we have as a health system in the past. But CHCs have really been trying to embody that for years and years, right? So when you think about in Ontario health teams are really about integrating care. So it's, and again, about coordinating care. CHCs have a really remarkable ability to be a bridge between the healthcare system and social systems, because this is what we have. If you look at KCHC, I can elaborate a little bit more. We have a primary care, like, at a core of a community health center is often primary care, but it's much more than that. We have an Indigenous health program, dental care, a full dental suite, early childhood programs, addictions and mental health, transgendered health, educational programs. The list really goes on and on, right? For CHCs. So we, as a sector, have been really working hard to integrate health and social services for decades. So to your question, why is it important and what is access like in Ontario? Yeah, I would say that CHCs are doing a tremendous job. If there was an opportunity for more funding to either increase the number of CHCs or increase the scope, we'd be able to tackle some of the really urgent health and social system issues that we're all facing, such as homelessness, such as the opioid crisis. The list goes on and on, like access to primary care, Indigenous health, and then the other aspect of thinking upstream. So where is health promotion at the federal level or the provincial level? CHCs have been really trying to embody health promotion for long-term, looking at like current immediate services that have an impact on long-term health outcomes. So I think for all those reasons, CHCs are a really good investment, provincially and federally.
That is a great segue to the next question, and I'm not sure if you have any more to add on that, but what would increased federal investment mean for you specifically at KCHC, and what would you be able to do with any increased funds?
We could do so much. Two things that come to mind would be, right now, our main federal funding, we're very lucky in Kingston to have some federal funding, and not every CHC has that. So the bulk of our federal funding is dedicated to immigration, so newcomers to Canada. So if we were able to have increased federal funding, we would be able to continue to address the health needs of newcomers to Canada, because it doesn't matter how many newcomers Canada is welcoming, there's a huge health gap in terms of settlement and making sure that everyone's feeling at their best as they come to a new country. So the first thing I would say is we'd be able to do more in newcomer health, because that continues to be a gap. And the second piece would be Indigenous health. All over the country and all over the province, we are starting to slowly start to understand what truth and reconciliation means. And I believe that if we had more federal funding for Indigenous health, CHCs along with our partners, depending on your community. So some communities are lucky enough to have Aboriginal Health Access Centers, or AHACs, and currently we don't have one. So if we don't have one, then more funding from federally would allow the CHC to work as an ally with our Indigenous counterparts to really try to improve and work with our Indigenous allies.
Wonderful. I want to thank you so much for your time today, Mike.
Thank you very much, Hillary.